Hello, I'm Rosalie Dutch, and this is my informative speech. Just imagine you are out and about, and out of nowhere, you're filled with crippling fear, your heart is racing, you're panicking, and you don't even know why. This can be generalized anxiety disorder, and this is how it can affect your everyday life. And there are ways to make it better. According to medicalnewstoday.com, last access on September 28, 2021, anxiety is a normal and often healthy emotion. However, when a person regularly feels disproportionate levels of anxiety, it might become a medical disorder. Generalized anxiety disorder, also referred to as GAD, can affect 6.8 million people in the United States. You or someone you know might be one of those people. In fact, I am one of those people. And the purpose of my speech is to inform my audience the causes, symptoms, and treatments of GAD. There are different causes of generalized anxiety disorder. One cause is genetics. Having a family history of GAD can increase one's chances of developing it. Brain chemistry can also play a role in causing this disorder. Imbalances of serotonin are present with people who suffer from GAD. According to hormone.org, last access on September 29, 2021, serotonin is the key hormone that stabilizes our mood, feelings of well-being, and happiness. So basically, serotonin is a neurotransmitter that fires off signals to your brain and body to help regulate mood, sleep, and many other aspects of the body. Life experiences can also cause GAD. Traumatic events like abuse or chronic illness are both big factors. Also, statistics show that women are 2 times likely as men to have GAD. There are different variations of symptoms of GAD. There is emotional, physical, and behavioral symptoms. First, I will discuss the emotional symptoms. Emotional symptoms are the feelings you have on the inside, like uncontrollable fear or constant worrying. According to the book Anxiety by Dr. Mark Cross, published in 2020, people with an anxiety disorder often spend too much time worrying about the future, constantly concerned about scenarios that will probably never transpire. With emotional symptoms, friends, family, and coworkers are not necessarily going to know what you are experiencing. You might have racing thoughts going through your mind, but no one even knows it. Next is physical symptoms. These are the symptoms that can cause aches and pains, or even cause digestive problems. Your body can feel the stress you're putting yourself under so much that it can make you feel physically ill. Lastly, there are behavioral symptoms. These are the symptoms that can disrupt your everyday life. They can be very persistent, and these symptoms can include being unable to relax, finding it difficult to concentrate, and you might have a hard time speaking in public. You may miss school or work, or you're constantly redoing tasks because to you they aren't perfect. There are a few different kinds of treatments for GAD. Some work well alone, but they are often combined to be most effective. According to the book Anxiety by Cheryl Winning Ganassi, published in 2010, strong empirical evidence has proven that a combination of psychotherapeutic medication and cognitive behavioral therapy is the most effective treatment for most anxiety patients. Cognitive behavioral therapy can often be a short-term therapy that helps one change their thought pattern or process, as well as develop coping skills. Then there are medications. Antidepressants or psychotherapeutic medications are often prescribed to patients with anxiety disorders. These drugs increase neurotransmitters like serotonin to the brain. From personal experience, I have found lifestyle changes to be extremely effective in combating my anxiety. Little things like regular exercise, eating healthy, and getting enough sleep are key in leading a less anxiety-filled life. Meditation and mindfulness can also help. To quote Joseph Ledoux in his book Anxious, published in 2015, along with relaxation, reappraisal, exposure, and coping strategies, some cognitive therapists today use meditation, or what is called mindfulness, as a part of a therapeutic program. And of course, avoiding drugs and alcohol can also help in a big way. Generalized anxiety disorder is a mental health disorder that can truly affect your everyday life. Today, I talked about how GAD can affect your daily life and how to cope with this illness, as well as the specific causes, symptoms, and treatments. Generalized anxiety disorder affects so many people in this country. It can be a scary thing to deal with, I know from experience, but it is not something that has to consume you. There are ways to live a happy, healthy life while coping with this mental health disorder. Thank you.